the nurse preceptor grants. And then we're planning on having a discussion about the nursing pipeline and apprenticeship program, a follow-up on the discussion we had at our last meeting. I also just wanted to say that on Monday, I'll be sending out an updated spreadsheet with all of the different recommendations from the strategic plan and my status of them. We will be presenting to the Green Mountain Care Board on the 19th of April on the status of those recommendations. And so if you could take a look at it and let me know if you see anything that could be updated or something that, an additional note would be helpful, please let me know before the 19th. So again, I'll just be sending that spreadsheet out that I know sent out many times already on Monday. Wendy, do you want to jump into the nurse preceptor grant update?
Yes, thank you. As many of you may know, Act 3 of 2023, Section 73, which recently passed, increases the amount of funding available for the nurse preceptor grant program. That allows us an opportunity to use any unused funds from the premium pay for workforce recruitment and retention program for this program and the nurse apprenticeship and pipeline program. Act 3 also allows us to add additional eligible healthcare employer types. So this program was previously restricted to critical access hospitals and now will be available to a broader set of healthcare employers. In terms of that funding source, as you may remember, there were a number of administrative challenges with the funding source being state fiscal recovery funds. The administration has a limited amount of state fiscal recovery funds that can be used as revenue loss. Those funds are less restrictive. And this program was one of the approved projects for use of revenue loss funds. So that means that the preceptor payments are not going to need to be tied to work performed during the public health emergency, which, as you know, creates challenges because that is ending on May 11th. The timing, we keep saying we're about to get these out, but we've had good news. So that means that it's slightly delayed, but we anticipate releasing the application very soon. It's currently pending formal approval under the new funding source. So we just had to go through the same sort of process we did before to get a final approval on how we're planning on running the program under this new funding source and the new, more flexible way I just mentioned. So we anticipate releasing that application soon. And we really will be looking for your support and outreach now that it's a more expanded provider group. We need to get the word out more broadly than before when we thought it was going to be just the critical access hospitals. So we're going to be putting all program materials on our Agency of Human Services website. We'll get word out to you and request your partnership in sharing the information with your networks. Are there any questions on that? Okay. Not seeing any. So next we'll have a discussion about the nursing pipeline and apprenticeship program. So similar to what I said about that program, about the preceptor program, we may now increase the available funding for this program too by allocating unused funds for the premium pay program. This program, the Nursing Pipeline and Apprenticeship Program, was also approved for use of those revenue loss funds. So that's going to allow us to expand the allowable uses of the funding from what we previously discussed. Previously, we anticipated we would only be able to fund tuition and fees. But now we want to think sort of more broadly now that we have this more flexible source. So Tara Murphy, who's working with our team to support program development and rollout of these grants, is going to lead a discussion on what some of those potential program elements may be. And we really look forward to your continued input and feedback. Also, thank you. You've been really helpful over these last few meetings and in between meetings to provide your insights and education to us. So we value that and look forward to the discussion today.
Wonderful, and it's great to see many of you again. Thanks, Wendy, for that lead in. Again, we've got the new flexibility and increased funding that Wendy just mentioned. We've also, since our last meeting, which I think was maybe a month or so ago, took back a lot of that feedback that we heard from all of you to kind of think about how we can really create a program that sort of serves Vermont in the best possible way. Before I jump in, I'll just give a quick thank you to Marianne Sheehan, who I have spoken with numerous times. She's been invaluable to this process. And we'll just open the door. I think the more feedback, the better, and the more insights, the better. So if there's anybody else who at any point would like to have a one-to-one conversation or a smaller group conversation, absolutely feel free to reach out to Wendy. And again, more than happy to chat as much or as little as is of interest. So with that, again, taking back our conversation that we had a month or so ago, we wanted to kind of really articulate considerations for the considerations that we have had in front of us for program design, and number one, kind of reflect that back to all of you and make sure that we're landing in the right place. So the big question that we've been asking ourselves is, can we design an approach to implementing this funding and within these parameters that really enables AHS to quote unquote seed numerous new pipeline and nursing pipeline and apprenticeship programs statewide. And we're thinking about, when we talk about sort of seeding these numerous new programs, we're really thinking about funding programs that include the full spectrum, right? So right on the sort of one end, that gold standard of programs that has kind of every single best practice in there, all the way down to programs that are absolutely providing high quality training experience, but may not have all of the same elements at this stage development as those what we were, for lack of a better word, calling kind of gold standard programs, those more fully developed and more robust programs. So I will stop there and just ask if that sounds like a good goal or the right goal to be working towards, as again, we're thinking about how to kind of put this funding to work. So thoughts, comments, corrections, door is wide open. Yes, and it looks like Jill is raising her hand.
Hi. So I guess, can you just say a little more, maybe give us a little more detail on what like a gold standard program would be versus not? Maybe it's because I'm not an educator, but I'm having a little trouble imagining what that might mean.
Yeah, so that would, and we can get into that on a few more slides, but and maybe
Okay.
this is something keep in mind as we go through the next slides rather than discuss now. So basically, gold standard would kind of have all of the recommended program elements, from tuition support right down to kind of very robust wraparound support for program participants. So we can go into that a little bit further going forward. Yep.
Okay. Okay.
Yep. So that's helpful. So we can come back to this question. In terms of discussion, we wanted to review the approaches to required program elements and funding that we've been thinking about so far, and then kind of have a more open discussion about what support might healthcare employers with fewer resources at this point in the development need to be able to successfully really participate in this funding that we're making available. So if we go to the next slide. To give a little bit more background, so just as a refresher, so Act 183 of 2022, Section 22, makes available funding to support a healthcare employer nursing pipeline and apprenticeship program. Again, per the legislation, the program will establish or expand partnerships with Vermont nursing schools to create nursing pipeline programs, apprenticeship programs, or both that will train members of the healthcare employers' existing staff to become higher level nursing professionals. So again, thinking about the words on paper for the legislation, if you will, staff members may include personal care attendants, licensed nursing assistants, or licensed practical nursing. And again, it can be a wider range, but that's kind of what's articulated in the legislation. And again, in the legislation, these funds will contribute to participants' tuition and fees at Vermont nursing schools. And as Wendy said a few minutes ago, key update since our last meeting, more funding is now available to support these new nursing pipeline and apprenticeship programs. And then we have greater flexibility, which is a great thing, in the use of funding. So initially, this funding was limited to tuition and fees. Going forward, we can actually do a lot more with it. We go to the next slide. So the approaches that we've been thinking about to these, and I think if we think back to a month or so ago, the question that we were sort of really asking ourselves at that point was, what program elements should be required? And I think based on the feedback that we heard from all of you, we're really taking a more flexible, or we're considering taking a more flexible approach to what program elements are quote unquote required. What we are doing though, knowing that there is this sort of, again, for lack of a better word, gold standard of apprenticeship program out there, if you had all of the resources and the time in the world to put something together, we are kind of thinking about outlining that list of, again, sort of, if we were creating the ideal nurse practitioner or nursing pipeline or apprenticeship program, it would include all of these elements. So to answer your question of a few minutes ago. So again, this ideal program would have education components, so that those education components would comprise academic education, so a formal partnership in this case with the Vermont Nursing School that offers a practical nursing certificate program, an associate's degree program leading to an RN, or sort of qualifications to become licensed as an RN, and or a bachelor's of science in nursing degree or certificate program, right? So that would be the academic education formal partnership with the nursing school. There would also be that employer-based education, which in the case of nursing pipeline and apprenticeship programs is typically nurse preceptor supervision at the healthcare employer. So that's the education sort of bucket of components, if you will. There would also be, again, in our ideal program, support, really robust support for program participants. So that would include financial support for tuition and fees. It would also include, sort of in that bucket of financial and academic support for living expenses in the form of paid release time for education, right? So for that time that you're spending in not sort of on the job completing your nursing role or lead up to nursing role, for that time that you're actually spending in school or studying, your employer would keep paying you your regular salary for that. I think in many programs, the wraparound support can be especially sort of critical to the success of participants in the program. So this can be support for career planning, but also support for navigating for program participants as they navigate sort of myriad social and economic factors that if you're a non-traditional student with a family, with a job, with other commitments, these sorts of things can complicate your progress if you're pursuing a degree. And then peer support. So you have others to lean on who are in the same situation that you are, or similar situations. A way that programs often get at this is making sure that there is a cohort-based program model for people going through the apprenticeship or the pipeline program. So they have peers going through the same process. And then last but not least, last bucket is program administration. So sort of acknowledging that programs that are somewhat complicated don't run themselves. There would be a clear sort of level of administration that is charged with, at minimum, kind of organizing and managing the process for selecting program participants, for managing that academic partnership and any employer-based education, for managing and coordinating the supports offered to program participants, and then managing any program budget and associated reporting. So again, that's gold standard ideal, if you will. And it looks like there's a question. So if you want to jump in.
Hi, my name is Betsy Hassan. I'm the Director of Nursing Education at the Medical Center. There are a few things that I would actually add as additional gold standard items. In the programs that we've built, we've also had to find our own clinical faculty to support our programs. So I would include, some onboarding support for clinical faculty that are direct care nursing staff. And I would also look at joint appointments. So one of their 3 12-hour shifts is actually released for clinical faculty time. So I would include those.
So kind of building out a more robust component around that employer-based education, if you will. Is that correct?
Exactly.
Great. Okay, that's helpful. Thank you. So this would be, with those additions, would be sort of that, again, ideal program. If we go to the next slide, acknowledging that not every organization that could benefit from a pipeline of nurses, nursing professionals, will be able to sort of out of the gate meet those standards. What we're considering in terms of an approach for this program is to acknowledge that nursing pipeline and apprenticeship programs are most likely to be successful and sustainable when they're thoughtfully tailored to the unique circumstances of the organizations in which they're established. So we would kind of make the extent to which an organization was able to sort of put in place all of those program elements that we just talked about, make that somewhat flexible. So to be eligible for funding through this program, an organization would not need to sort of check all those boxes, if you will. But to ensure kind of a baseline of standardization across all of the programs that we would fund, what we're considering is requiring the following program elements. So an academic education component that is formalized through a sort of articulated partnership agreement with a Vermont nursing school. A formal plan for employer-based clinical education. So do you have nurse preceptors? How are you going to provide some level of sort of organization and oversight and support for those nurse preceptors? Financial support for academic tuition and fees for program participants. And that financial support could come from scholarships and grants, as well as support directly from the program or the employer. Financial support for living expenses for program participants in the form of that paid release time for education, and some sort of plan and resources for administering the program. So the difference between when we were speaking last month and when we're speaking now is when we were having this conversation last month, at that point, we only had funding available for tuition and fees. What we're contemplating is making funding available for, at some level, sort of all of these required components. So if we go to the next slide, we can talk. So this is, again, our what we're considering now for the anticipated approach to funding. So we would fund tuition and fees as requested by the applicant organizations based on the number of participants and the nursing school costs. We would fund paid release time for education as requested by the organization based on the number of participants and salary and benefit costs at that organization. And then we would basically make available, in a way similar to a grant, funding up to a cap for program design and administration, and or academic and wraparound support for participants. And that would be up to $100,000 in year one, anticipating that there might be some startup costs for organizations, and up to $75,000 for these potential uses in years 2 and years 3. And just a quick note that funding for tuition and fees would also be available for formal academic preparation programs that somebody, for example, coming from a nursing assistant or sort of home healthcare or sort of similar roles might need in order to enter into a practical nursing certificate program. So that would be included in what we would fund under that tuition and fees category. So I'm going to stop there and kind of ask where all of this lands, and kind of take us back to that guiding what we're thinking about trying to achieve when we're putting this program in place. Can we get some sort of really robust programs out there in Vermont, but also at the same time fund organizations that might not be able to kind of meet all of those program elements at this time, but give them funding to kind of get them on their way. So thoughts, questions, comments, anything, more than welcome.
I have a thought, usually do, but thank you, Tara. I think it looks great. One of the things I was thinking about was for like some programs, like let's use a visiting nurse association, you know, like a local setup. They might just have a few people who are participating. And then other hospitals that are bigger might have, say, 2 cohorts. I was thinking about the administration associated with, you know, the number of people who are doing these things. And then also how to maybe combine a cohort. So if there's somebody, like, let's say there's a small hospital, Grace Cottage down in Brattleboro, that wants to partner with a visiting nurse and a rehab center for a cohort. Perhaps that's one strategy for, you know, sharing some of the academic administration responsibility. I don't know.
Yeah. And we. Oh, there's an echo. Oh my. I'm hearing two of me.
We don't hear 2 of you.
I hear 2 of you, so it might be
We hear
Marianne.
Marianne, you need to mute.
Okay. Great. Wendy, I'm glad you jumped in and you said you heard 2 of me as well, because I would be concerned. So Marianne, no, that's a great point. And we actually have a slide coming up on sort of strategies for engaging those smaller groups, those smaller, maybe less traditional employers. And that is, as you and I have discussed, that is actually one of them. Could there be a world in which these smaller employers that may not have the bandwidth and may never have the bandwidth in the future to do this administration piece, could they partner with a larger kind of neighboring hospital or larger employer to make sure that to bring that clinical training and that pipeline to them as well? So yes, thank you for raising it. And it looks like I can see another hand raised, and I apologize, I don't know all of your names, so.
Oh, sorry, if it's not showing.
Yep.
This is Jill.
Yep.
Yeah, I mean, so I work for the home health and hospice agencies. I wouldn't call them non-traditional employers. They hire nurses every day. But some of them are a lot smaller. I don't know how well it would work for them to partner with a hospital. I don't know how hard that would become. I am worried as I listen to this about because, you know, if they have 2 PCAs who are ready to become LNAs, we want them to be able to do that. But to have to make a program, I worry is going to be too much. I sort of feel like this is always really hard for me. I do not run a home health agency. I run a trade association. And so, you know, there starts to be a point in these things when it's really, you need input from my members, not from me, in order to be able to think this stuff through. So I have lots of ways to make that possible, but I kind of feel like we need a conversation with some of those smaller employers more directly. And I have some times when I could make that work when they're already gathered.
Yeah, happy to do that. And kind of thinking through, so I have like a mental Rolodex of other workforce development programs that I've worked on in other settings. One of the ways we've kind of gotten to, it's not a direct parallel, but could have implications. One of the ways that we've gotten to that like centralized component for lots of smaller organizations in other workforce development programs was to sort of almost centralize a lot of that administration in a related group. In this case, it was in Massachusetts, our quasi-state agency for workforce development. We put a lot of the coaching and support and so on and so forth at that organization, and then the smaller employers were able to sort of like tap in with 1 or 2 staff members who benefited from kind of that more robust administration and supports available and so on and so forth, but didn't have to do it themselves, if that makes sense. So there may be a workaround we can come up with that isn't partnering with a large hospital, which is also a kind of another strategy. But yeah, happy to talk and brainstorm.
Yeah, this is Devin. Sorry, I'm by phone, so I hope I'm not talking over anyone. But I agree with Jill. I'd like to take some of this back to my members. So I'm wondering what the timeline is on this in terms of getting responses and how quickly this program is moving.
I defer to Wendy on that one.
We have some time on this one, but we want to make sure that people can get into the cohort, so the start of the next academic calendar. So I think we were hoping that this application period would go live June. I think we're looking at June right now would give us time to finish up this program design and get it through the process that says, yes, you have this new, more flexible funding source, but we're also just going to make sure that all of these components are still allowable use of the funding. So we still have to go through that component. That said, I always say more than I probably need to. That said, I think we have some time, some weeks to have these conversations with you and your members to get that feedback and make those refinements. And I can see who's raising there. Oh, good. Thanks, Devin. It looks like Betsy had her hand up next.
So I just want to, from a employer and clinical clinical rotation site, I just want people to know that we're already having our fall 2023 clinical placement meetings next week to ensure that we can meet capacity for what's already in the state. So I think that, as you think about these programs, there needs to be a conversation with those clinical sites to ensure that they actually can have capacity for increasing cohort sizes, because that is going to be a restraint, especially in the specialty areas.
If we go to, I think it's the next slide, we can talk a little bit about the timeline that we've been thinking about. Yep. So what we've been thinking, and
two more hands. But you can finish that. You finish that, and then I'll get the other hand. Sorry.
Okay, perfect. So yeah, what we've been thinking about in terms of trying to thread that needle between getting started and like kind of getting money out the door and some impact from the funding that we have available, and kind of knowing that all of this is pretty much, a lot of this is pretty much underway at a lot of sites that are already established in terms of gearing up with participants for the fall semester. We've basically envisioned 2 funding rounds. The first would, as Wendy was saying, we'd be looking to get out the door by June, to release by June. That would provide up to 3 years of funding. The first program participants would be expected to begin the academic coursework in fall 2023. So it would really be, to the point that was just made, hoping to expand programs that were kind of established now. As we said in the last bullet point, expected to engage healthcare employers with an established nursing pipeline apprenticeship program, or those that have been actively planning to launch such a program in the fall of this year. And then round 2 would come out a little bit later, would provide up to 2 years of funding. First program participants would begin academic coursework in fall of 2024, and this would be sort of really looking to engage healthcare employers that this might be brand new for, or might not have been possible without this funding being put on the table. And the kind of parameters that we need to work within. So per the legislation, all program funds must be expended by December 31st, 2026, and all program participants must be working in a higher level nursing role, again, by December 31st, 2026. So yes, so we're thinking about how to knowing that things are in flight right now, and how can we get some of this money put to good use sooner rather than later, but also, you know, thinking forward to fall of 2024 and some programs that might be brand new. And so Wendy, I know you were looking at the other hands
Yes.
that were raised.
Looks like Jessica has her hand raised. I'll go back to the slide.
Yeah, so my questions were really around timeline, but you helped clarify those. But I work with Jill. I'm the director of human resources with VNA and hospice of the Southwest region, and I echo her sentiment on really the importance of getting some feedback from us. And I know even amongst the different agencies, we all have faced our different challenges, and I would like to kind of put our heads together and see how we can even work together as a home health kind of cohort, we'll call it, because I think we have some similarities, but we do face some individual challenges. So I think that could be very helpful. I am also a little bit concerned about the timeline. Just I'll say that hearing that Betsy is already having some conversations next week about the fall, and knowing how hard it is to kind of get all of these balls in motion. But thank you for clarifying that.
Yeah, no worries. And we're open to suggestions about, again, we've got the 2026 as the date that we all kind of turn into pumpkins, right? And this money has to be spent, and or we lose it. So trying to gear up to kind of meet that parameter. But if all of, and knowing that this is tied, whatever we do is tied to an academic calendar, right? So we can't kind of start mid-year with most things. So open to suggestions if anybody else has thoughts about how we can navigate that end date and then the academic calendar that we're up against as well.
Looks like Maureen has her hand raised.
Yeah, I'm sorry that Sherry jumped off, but usually students are accepted to an accredited LPN or RN program by around this time, March, for fall of 2023. So I'm just wondering how that timeline might be taken into consideration. Because most of the faculty resources, certainly have limited cohorts if you're going to be using an academic institution to support related instruction.
So it would be, and forgive me because I'm kind of making things like thinking through the question in real time, but it sounds like the sort of the limiting factor that you would bump up against is the clinical faculty. Do the programs ever create almost like a wait list in
They do.
the apprenticeship? So would it be possible if you sort of knew that more funding might be coming, you could plan to perhaps pull from the wait list?
Well, the limiting factor, I think, is the size of the classes. So, and we have a limiting factor of the number of faculty members teaching that are qualified. So that's another piece.
So to make sure I'm understanding correctly, so the limiting factor is, I understand the faculty, but the people who are accepted, let me ask a clarifying question. Are you speaking from a nursing school or from a healthcare employer?
So I did work with VTC and now work with UVM. So
Okay.
Given accreditation, we have to have certain size classes and a certain number of instructors that are working with those students. And then the clinical piece is the other limiting factor because we can only have a certain size cohort going through clinicals. Does that make sense?
It does. And if I'm just trying to thread back to the healthcare employer. So,
could I make a suggestion?
Yeah.
So I think it depends on where you're starting your pipeline, right? So like you could start a cohort and probably their prerequisite classes at CCV this fall, and then you're planning very quickly for them to apply to VTC for that next year or whatever program you're going to partner with. So I think if the aim is to get people in a program that's not already established with these funds for this fall, my recommendation would be those prerequisite courses that way.
And so when the healthcare employer applied, they would be submitting an application saying, for example, we want to have funding to put 6 people into the allied health preparatory class, right? And then the second year of that funding that they've requested would support enrollment in a practical nursing program. Is that correct? So that would be a little bit less tied to the acceptance decisions that are happening now for nursing schools. Is that right? Did I interpret that the
Yes.
right way?
Mm-hmm.
And so that might open it this sort of fall semester, if you will, to programs that are also newer.
Yes, and I would also, I don't know if anyone from Norwich is on the call, but they have an accelerated bachelor's program that their students are ready for licensure within 12 months as a registered nurse. And those are for those that have a previous bachelor's degree. They have both a August and January start date for that program. So that may be even, and they're looking for growth throughout the state. So that could be another program that's utilized for these funds in a sooner start date.
That's amazing. Thank you.
And I'm seeing that, I think Jessica's hand's just up from before, but let me know if that's incorrect. And then I think I've seen Marianne just type something into the chat.
And Marianne's saying there are a lot of ways students can enter the pipeline through an employer. There's always movement, and CCV does a great job of preparing people for the LPN application. Great. That's very helpful and something and reassuring. Okay, so it sounds like we're going to have a couple of follow-up meetings to think about smaller and not non-traditional employers, but sort of non-hospital, non-health center, et cetera, employers. So that will be kind of on the to-do list. If we don't have any more comments or questions on just the required program elements, and it sounds like there's no big comments to sort of, if we're able to put funding behind it, requiring a more robust set of elements like paid release time, so on and so forth. The change seems to be that we're requiring them, but we can also fund them given this expanded funding that we have. Great.
Yeah, funding it is what's important. We don't, you know, in home health, most of the people who would be getting trained up would definitely need to keep working, and we definitely don't have resources to pay them while they're training. So yeah, so that's definitely a limiter. I put in the chat when my group meets, and I'd be happy to just talk offline about bringing some of you guys to that meeting, and I would invite our HR leaders as well to that, so that you could have a more sort of in-depth conversation with home health instead of the, I mean that they're already gathered at. It's a little easier to get their attention. Wendy just came to my board meeting, so I thought they were very engaged. Yeah.
Yes,
Wonderful.
thank you.
Yeah.
That's great. Okay, excellent. So if we go to the next slide, I think our other big question, and this is a good segue, is what support might healthcare employers with fewer resources need to successfully participate in this program? So sounds like we'll do some more brainstorming about this at upcoming meetings, but the suggestions that we've been thinking about so far. So those regional partnerships comprised of smaller and larger, but smaller, and again, less traditional in a certain way, healthcare employers. So that's one idea that we've been thinking about. Another, again, something that we used in Massachusetts for a couple of programs, a learning community or regular meetings for healthcare employers that include both employers with established programs and employers that are still planning for a nursing apprenticeship or considering such a program, or maybe just they've gotten some funding and they're getting started with this. So that you can really do some sharing of ideas and best practices and helpful hints, and also bubble up to kind of policymakers where the needs and the gaps and the need for extra support is. Other thoughts about, again, if you're not a huge, well-resourced hospital and you want to get something like this started and benefit from the money that is now on the table for a little bit, what kind of supports could we think about putting in place? Or frameworks for engaging, as we were talking about, frameworks for engaging those smaller employers.
Yeah, I just want to make a comment about resources that I think you'll hear from members. In some ways, what I worry about is actually not having the people power to do the organizing and applying. That's the thing they don't have. They have very, many home health agencies have a pretty lean management structure. So there just sort of isn't a person who can like do all the work to make a program. And so I kind of liked what you mentioned earlier around maybe having something external that an employer that might have a smaller number of people who want to participate could plug into instead of having to build something within their own shop. That's what I really worry about, is trying to build something that doesn't already exist.
Yeah. And it sounds like it's twofold, right? Because we're giving that or making available that up to $100,000 or up to $75,000. But even to get at that, it sounds like you would need somebody who could write the application.
Yeah, exactly. Somebody who can like take the time to do that level of focused work. Yes. Yeah. So yeah, I do worry about just having the ability to even take advantage of things sometimes because of that low bandwidth.
Yep. Got it. Now it looks like there's another hand up.
So when we did this work with CVMC a few years back, the Vermont State Colleges, CCV, VTC, did that work for the employers. So set up the program, managed all of the requirements, and did the reporting for the apprenticeship program. So that's a model I think that works really well. The other concern that employers may have, because I was just with an employer last week, is the backfill, people that are going to be taking classes who will take on their roles within the organization. So something to consider.
Yep. Yep. And I can give a couple of examples of kind of ways that we tried to navigate this question in Massachusetts for a couple of different programs. So there was one program that we did was modeled on, it's called the Healthcare Fundamentals Management Certificate Program, and basically took people in healthcare and similar sorts of employers with less than an associate's degree, and made available this kind of competency-based training certificate program through Southern New Hampshire University, which got them a certificate, got them some really important skills, and got them sort of half of the credits that they needed to go on and earn an associate's degree. We modeled this on a really, really robust program that had been designed at Partners Healthcare. So Mass General Brigham Healthcare, really like the biggest employer in Eastern Massachusetts, very well resourced academic hospital system. The way we were able to get at a lot of those, and I would call them wraparound supports and program administration, that a lot of our smaller community-based behavioral health providers and long-term LTSS providers could sort of never have ever had the bandwidth to kind of include in their organizations. We situated all of that program administration plus wraparound supports at, as I said before, a quasi-state agency that was responsible for workforce development across Massachusetts. So I think we had about 27 different small employers tapping into this at one point, but they got all of that support, not from within the employer, but from within this sort of centralized group. So that was something that worked incredibly well. And there was part of that program administration that was responsible for liaising not only with the program participants, but with the smaller employers as well. So it wasn't kind of floating separately, right? Another program that actually reminds me a lot of this program that we tapped into this learning community, regular meetings for healthcare employers. This was a family nurse practitioner residency program that we established in, I think it was 8 or 10 FQHCs, small community health centers across Massachusetts. The learning community that supported all of this, including helping organizations with their applications, was housed at the Massachusetts League of Community Health Centers, which is a membership organization and advocacy organization for for all community health centers, FQHCs in Massachusetts. So those are both sort of examples of that smaller organization, but partnership and support from a larger kind of almost membership body, if you will. So it's doable. Anything that we should have asked or should have been thinking about that we are not at this point? Or any kind of parting comments or words of wisdom?
Can I ask a technical question? So some lovely person who's on this meeting just like messaged me through Teams. I saw it for a second. And now I don't know how to find it again. I didn't know you could do that. How do you do that? One-to-one communication.
Oh, I didn't think you could. Was it something in the chat or?
No, I don't think so. Maybe it is. I don't know. I feel like not. I learned about Zoom, a new Zoom trick the other day that I didn't know about saving the chat in Zoom. So
I
think it was direct.
I messaged you.
You did? How do you do that?
You just click on your name and then you go to people and click on your name. And then instead of chatting with everybody, you can just chat with individual people.
So I'm thrilled to learn how to do that because I've always been like, why can't I just chat to the individual person if that's all I need? You can. I've learned so much this week. Okay, thank you.
Yeah, you're welcome.
I'll chat back.
I don't think mine does that, but
let's see. I'm gonna test.
You can also email them directly with their email through that also.
Yeah, I can't do it either. It's really interesting. I
just did it.
Yep.
You did? When you clicked on the person's name or on the 3 dots? What did you click on?
When I clicked on the person's name, it drops down and it says chat quickly.
No,
Jill, maybe you and I have the same license and they have a better one.
Mine doesn't do that. Okay.
Hey,
All right, I'm learning.
Can I ask this is Devin from Buzz. Can I ask a quick question just to confirm whether or not I'm losing it? I thought at the last meeting we had heard about a website with all the resources coming out near the end of March. Was I hallucinating on that, or is that something that is happening?
You were not hallucinating on that. An update of that site went up on the 28th. Actually, in one moment, I'm gonna paste that link in here. Forgot which of these many tabs that might be. So I think I mentioned last time that this doesn't include a lot of the Act 183 programs that still have not started, but this mentions and has links for all of the current programs. Okay, I probably just closed this. Let's go back to our website. It's also going to keep being updated. This is really especially because we're very soon going to have more programs to add in there. Also, sorry, bear with me. I'm just digging through this thing. I think I also mentioned last time that we're trying to get a shorter address than the one that you're about to see. And that is still in the works, but it should just be something with just one dash in it instead of these 4 that are in here. But okay, here we go. This is the current page. We are very open to suggestions on layout of things that should be added in there. Coming up with what to put in this table was a very confusing process. So if anyone has any suggestions, feel free to reach out to me, please. And we also tried to include some of the programs that are not state funded out there, like the Delta Dental program. So if there are other programs that aren't state funded that I didn't list on here, it's probably because I don't know about them. So please let me know if you have anything that should be added to here. And
great, thank you.
Yeah.
This is great. Just that there's a website is great. I'm sure we'll have suggestions, but I'm thrilled to see it up. So thank you for doing this.
Great. Yeah, and my contact info is actually at the bottom of the page. So yeah, look forward to suggestions.
Are there any other general questions or comments anyone wants to make? Any other updates from that folks would like to share?
Tips and tricks for Zoom and Teams, or we could have like technology corner.
Learning community.
It's clearly Friday afternoon.
By the way, Jill, I was able to do it just for you, and now I can't figure out how to do it with anyone else.
Oh, I wonder, that's interesting. And you just clicked on me in the participants.
Something like that, or I did a hover. And
you hovered over my.
Yeah, but
I
now
love
no one
that
else
this
is
is
hovering.
part of the recording. This is good.
They memorialized forever my ineptitude. Yes.
I think I double clicked on the circle with your initials in it, and that worked.
Yeah, that's not working for me. So I think there must. Oh, it just worked. I am so happy. This meeting was worth every second. Thank you.
Well, with that input and all of those technical learnings, okay, there's another comment in here.
Probably, I'm not familiar with those, but please, I guess just so my email is at the bottom of that page. Actually, just send along any suggestions. I'd love to learn more about what those programs are. Thank you.
I have a question before we close out. So I don't know if I haven't introduced myself, Mary Kate from Bi-State. We are a PCA similar to Mass League, supporting Vermont's FQHCs. If we want to figure out a way to bring you in and talk directly with our members, because I think that's where you get the most, to Jill's point, most meaningful conversations, who do we reach out to? Tara, directly to you, or through Wendy, or who's our phone a friend?
You can reach out to me, Mary Kate.
Okay, thanks, Wendy.
Great, thanks. Okay, well, it sounds like we can give you a few minutes back, but Laura will be sending up that spreadsheet, so that will take up more than the 4 minutes we're giving back. So we hope to be able to get your updates so that we can present the most up-to-date information at our meeting on the 19th at the Green Mountain Care Board. So thank you very much.
Bye, everybody. Thanks.
Bye, everyone.
Helpful. Thank you.
Thank you.